So I understand that you run a primary care clinic. You have a number of attending physicians as well as nurse practitioners, as well as physician assistants, along with other ancillary staff members that report to you. And just help me understand, what are the services that you provide at your clinic?
I mean, we're basic primary care. We do have some support, sort of social work also, but we see a full adult population, some locally, and some come from pretty far.
Okay. And your state is in the midst of an opioid epidemic right now.
It's a complete crisis.
Yeah. So a number of people with opioid use disorders, likely with other co-occurring substances and other co-occurring psychiatric conditions.
That's right. Basically, we're seeing these people. We're just not right now. I feel like we're not treating them.
Yeah.
Other than for what's most important, I think.
Yeah. What is your sense about treatment? How do you feel about medication-assisted treatment?
Look, I'm all in, and I don't know how much you know, but we really tried here a couple of years ago, and it was, we were all enthusiastic. I feel like I had the team on board, and it was just kind of a disaster.
Wow. What happened, if you don't mind just sharing with me?
I would say it was a range of different reactions with the staff. And I want to take on some responsibility because I think we were so gung-ho to start. We so much felt it was the right thing to do that I think we jumped in a little bit too quickly. Not that we cut corners, but I don't think everybody was as informed and on the same page as we should have been.
Sure.
And it was a lot, actually, even though I think it's pretty straightforward. It's logical what was asked of us, but we had trouble knowing at different decision points how to handle it.
Yeah. Well, what you're describing is fairly common when people start providing medication-assisted treatment. Sometimes there's a perception that it's like any other medication, and although it is a medication like medications for diabetes or asthma, because it's a controlled substance, it can create a number of other anxieties, both in the providers, but also in the patients, because they're at very early stages of their recovery and don't have perhaps many of the coping skills to deal with their own emotions. So you guys tried, you had a very difficult experience. You're still on board, you see the crisis. How does your clinic feel about this?
There's always going to be, I've learned more. I need to listen to all the different voices. Some people have since left, so it's a bit of a different crew, and I'm a little bit more hopeful. But it was anything from, we started out, probably took on too many patients first before we felt confident enough. And we did have a visit from the DEA, which I knew could happen. And even though it went fine, it just caused an incredible amount of stress. Just people suddenly feeling like, hold on a second, I'm trying to do the right thing here, and I could get, sort of cited in some way for my license, for my livelihood. And I have to say I understood it. I still think we should try to do it, but I want to support them better and make sure we're doing everything.
Yeah. It's very important that that be acknowledged, because that is a reality. I will say that in general, as long as there are good policies in place and those policies are followed, so everything from what is their standard policy, what is the policy for dealing with situations that come up, such as missed appointments, lost medications,
so
missed
can we
testing.
talk about that for a moment? Because one was just the difference in how clinicians reacted to patients that we were then supposed to say no to, right? So some were softer, right? Somebody missed an appointment and they had trouble sort of sticking with the protocol, and I kind of understood that. And some were just, so strict and, right to sort of call the police if we needed to, right?
Yes.
And I had a hard time sort of shoring up consistency among the staff.
That's a very important word, consistency, and that is one area that I'd recommend very strongly, that people have similar rules that everybody abides by. There are no favorites, or there are no people who have a very short room for error. So having great consistency, having a process where how you deal with those situations, and continual training as well as exposure for your clinic staff would be very helpful.